All right, team. Here are the symptoms. Golfer's vasculitis, type 3 diabetes, and dermatopolymyositis. What are we dealing with here?
Well, it could be a mix of different conditions. Golfer's vasculitis points to inflammation of the blood vessels. Type 3 diabetes suggests pancreatic issues, and dermatopolymyositis indicates skin and muscle inflammation.
I think it might be a rare case of autoimmune disease given these symptoms. It's tricky to pinpoint a specific diagnosis without more information.
I agree with Leslie. This is quite complex. We need to narrow it down.
I'm leaning towards a genetic disorder causing these diverse symptoms.
But it's tough to say for sure without further tests.
Enough guesses. This is tetrahydrobiopterin deficiency. We need to act fast. The only way to save this patient is through a peritidectomy.
But sir, peritidectomy is a risky procedure. Are you sure this is the right call?
Damn it, Gary. I didn't spend years in medical school to have my judgment questioned. We're saving this patient, and that's final. Prepare for surgery, all of you.
Understood, Dr. Hawks. Let's get ready for the procedure.
I'll start prepping the OR immediately. We have no time to waste.
I'll get the necessary equipment ready. We'll make sure this patient comes out of this stronger than ever.
Good. Let's move, team. We've got a life to save. Tracy, you called me in here?
Yes, Hawks. I have concerns about your plan to perform a peritidectomy on your patient with tetrahydrobiopterin deficiency.
Don't doubt my expertise, Tracy. I know what I'm doing.
Hawks! You have a history of jumping to conclusions. Remember the last misdiagnosis that caused unnecessary harm to the patient?
That was an isolated incident. This time is different. I have a strong feeling about this diagnosis.
I can't let you proceed without further evidence. We need to run more tests before we consider such a drastic procedure.
I refuse to be doubted like this. I stand by my decision, Tracy.
I'm just trying to prevent any more mistakes. Let's work together on this and make sure we have all the facts before moving forward.
Leslie, the patient is in critical condition.
We need to act fast and figure out what went wrong with the peritidectomy.
Oh no, that's terrible news. We have to focus on stabilizing the patient first before we worry about anything else.
I know, but we also need to address the fact that the peritidectomy was not the correct treatment for tetrahydrobiopterin deficiency. How should we tell Hawks about this mistake?
Frank, right now, the most important thing is the patient's well-being. We can deal with the communication aspect later. Let's work on a plan to save the patient first.
What were you thinking? You nearly killed the patient with your incompetence. Wrong peritidectomy and wrong diagnosis.
We did our best, Hawks. The situation was complicated.
I still think it was a case of lithiasis causing the blockage, not a tumor.
I disagree. It seemed more like a neoplasm based on the scans.
I thought it could be a cyst based on the symptoms presented.
You're all clueless. I don't know how you even passed medical school. Get your acts together or get out of my team.
We'll work on improvement, Hawks. We won't make the same mistake again.
I'm done with all of you. Figure it out or you're all out of here. So, Johnson, how's everything going outside of work? Any exciting plans for the weekend?
Oh, the usual. Just trying to relax and unwind. I might catch a movie or two.
That sounds nice. Personally, I've been consumed by this puzzling case. It's like nothing I've ever seen before.
Really? What's so intriguing about it?
I can't quite put my finger on it, but I feel like I'm on the verge of a breakthrough. Excuse me, Johnson, I think I just figured it out. I need to go. Goodbye.
Wait, what? Hawks, you can't just leave like that.
I have a new diagnosis, paroxysmal exercise, induced dystonia.
What the hell, Hawks? You can't just barge in here without proper gear.
This is a sterile environment. You know better than this.
Hawks, you're risking contamination for all of us.
Ignoring safety protocols is not acceptable, Hawks.
Forget about that now. The prognosis for paroxysmal exercise, induced dystonia, is favorable with proper treatment.
What kind of treatment are we looking at here, Hawks?
Is it manageable or will it require extensive interventions?
Hawks, you need to reconsider your approach if we're going to work together as a team.
Tracy, I finally found the right diagnosis for the patient.
Excellent job, Hawks. I knew you could.
If only I didn't have to deal with such idiotic doctors on my team.
What do you mean by that? You were the one who initially misdiagnosed the patient?
Well, my diagnostics team could have caught it sooner.
You can't just shift the blame to them when you made the wrong call yourself, Hawks.
Hawks is silent.
Hawks, where are you going?
I need some air. Leaves abruptly.